Today I want to talk to you about bleeding disorders. I will cover number 1, thrombocytopenia, number 2, impaired platelet function, number 3, coagulation factors, deficiencies, and the number 4, DIC, which stands for disseminated intravascular coagulopathy. The question is, how are platelets involved in homeostasis? Platelets are involved in homeostasis by platelet aggregation, which forms a platelet plug at the site of bleeding. Bleeding relating to platelets may be due to, number 1, decrease in platelet production, number 2, increase in platelet destruction, and number 3, impaired platelet function. What are the common areas that bleeding may occur? Bleeding may occur in the mucous membrane of the nose, in the mucous membrane of the mouth, in the mucous membrane of the GI tract, in the mucous membrane of the uterus, and also when there is pinpoint bleeding under the skin, it is known as petechiae, and this is due to platelet deficiency. Then also bleeding under the skin that cause a bruise or purple appearance is known as purpura. Let's talk about thrombocytopenia. Thrombocytopenia is a reduction in platelet number below 150,000 per microliter. Thrombocytopenia may be due to bone marrow dysfunction from radiation and chemotherapy. It also may be due to increased pooling of platelets in the spleen. Thrombocytopenia may also be due to antibodies against platelets that facilitate destruction. These antibodies attack the glycoprotein 2B3A receptors on the surface of the platelets. Thrombocytopenia may be due to some drugs like aspirin and atorvastatin. And finally, thrombocytopenia may be due to heparin. Let's talk about immune thrombocytopenic purpura, or ITP. Thrombocytopenia may be due to immune thrombocytopenic purpura, ITP. In this condition, antibodies bind to platelets and cause excessive destruction. This is an autoimmune disease. It is called primary immune thrombocytopenic purpura. This affects both genders and all ages. The platelet antibody complex that is formed exposes the platelets to phagocytosis in the spleen. The clinical manifestation of immune thrombocytopenic purpura include bruising, bleeding and epistaxis, melena, abnormal menstruation, and splenic enlargement. How is immune thrombocytopenic purpura diagnosed? The diagnosis is based on severe thrombocytopenia that is less than 20,000 per microliter, and also the exclusion of other causes that could cause the thrombocytopenia. The treatment of immune thrombocytopenic purpura includes corticosteroids. Let's talk about thrombotic thrombocytopenic purpura, or TTP. This condition is caused by uncontrolled platelet aggregation, which is responsible for generalized vascular occlusion and organ failure. This condition is a combination of thrombocytopenia, this thrombocytopenia may result in petechiae and vaginal bleed. It also can be caused by hemolytic anemia, renal failure, fever, and neurologic abnormalities such as headache, seizures, and altered mental status. The treatment of Thrombotic thrombocytopenic purpura would include plasmapheresis and plasma infusion. 80% of the patients usually recover after treatment. Let's talk about impaired platelet function. Impaired function of platelets may be hereditary or acquired. The two most common inherited disorders of bleeding are von Willebrand disease and hemophilia A, which is factor VIII deficiency, and hemophilia B, which is factor IX deficiency. Von Willebrand disease. Von Willebrand factor is synthesized by the endothelium and megakaryocytes and is required for the adhesion of platelets to the walls of damaged blood vessels. If platelets cannot adhere to the site of bleeding and create a plug, then bleeding will continue. The clinical manifestation of von Willebrand disease would include epistaxis, oral bleeding, GI bleed, heavy menstrual flow, and prolonged bleeding time with normal platelets. The treatment. The bleeding is usually mild and treatment is not routinely given. However, when treatment is being considered, one of the things that needs to be done is to avoid aspirin. Let's talk about hemophilia A. This is an X-linked recessive disorder that primarily affects male. There is either a deficiency of factor VIII production or a defect in the function of what is produced. The clinical manifestation of hemophilia A would include soft tissue and mucosal bleeding, number two, GI bleed, and then thirdly, bleeding into the joint from simply walking. The treatment of hemophilia A. Number one, avoid contact sports. Number two, avoid aspirin and NSAIDs. And number three, factor VIII replacement therapy can be given, and when it is given, it can be given at home. Let's talk about acquired disorders. Clotting factors 5, 7, 9, 10, 11, and 12, along with prothrombin and fibrinogen, are all synthesized in the liver. In liver disease, the production of these clotting factors can be reduced, resulting in bleeding. Factors 2, 7, 9, and 10 and prothrombin require vitamin K for normal function. Vitamin K is a fat-soluble vitamin that is produced by intestinal bacteria. Let's talk about DIC, or disseminated intravascular coagulation. The two great events of DIC are coagulation and bleeding. When there is excessive bleeding, platelets and clotting factors rush to the site in an effort to plug the injury and achieve homeostasis. However, in some cases, all the clotting factors and platelets are utilized in trying to stop the bleed. When that happens, the bleed continues without clotting factors and platelets and ultimately becomes worse. Bleeding becomes generalized in every organ and tissue, and subsequently it's called DIC. Here's a schematic of DIC. When there is severe bleeding, regardless of the cause, the clotting factors 5 and 8, fibrinogen, and platelets migrate to the site to form a plug. Most times, these clotting factors are fully consumed with subsequent clotting formation. As a result of these clot formation, plasmin is released. Plasmin is designed to break down fibrinogen and prevent clots. As a result of fibrinogen being broken down by plasmin, platelet aggregation is inhibited. Fibrin polymerization is inhibited, and thrombin is inhibited. This leads to uncontrolled bleeding. So DIC starts with bleeding, consumption of clotting factors, microclot formation, the release of plasmin, and finally the inhibition of platelets, fibrin, and thrombin, with full-blown hemorrhage as the end result. Well, thanks for watching, and I hope this short presentation gave you the foundation on which to build a deeper understanding of DIC. Please don't forget to like, share, and subscribe. I wish you well. Good night.